You are the FI1 working in psychiatry. At the weekly meeting, the consultant starts discussing a patient who has recently relapsed and restarted taking heroin. You realize that the patient in question is the husband of someone you lived with during your first years of university. She had never mentioned that her partner had a drug problem, and you know that they have a young baby at home. Choose the 3 most appropriate actions to take in this situation. A. Discuss with your consultant after the meeting what you know about the patient and your concerns about the child's welfare. B. Find a contact number for the patient and ring him so that you can tell him your concerns about his child. C. Following the meeting, discuss with the consultant that you know the patient and would therefore rather not attend meetings in which his case is being discussed. D. Leave the room so that you do not hear any more information about the patient. E. Organize a meeting with your friend and the patient and bring up his drug problem so that you could discuss it together. F. Ring the patient's GP and inform him of the relapse so that he can follow up on the family. G. Tell your friend about the patient's drug addiction as they are at risk, since this is a potential child protection problem. H. Use the fact that you know the patient's history and social circumstances to help the multidisciplinary team, MDT, in their management of the patient, as you are concerned about the baby. Answer: ACD. In this situation, the best thing to do is to make your consultant aware of the difficulty you have with the situation, as, by knowing the couple, you are personally involved and are at risk of breaking confidentiality, either by accident or on purpose to protect your friend and her child. The best responses here are therefore options A, C, and D. To immediately remove yourself from the room and subsequently share with your consultant both your concerns and your personal difficulty with the situation. Option B is obviously a breach of confidence, and, as an FI1, it would be inappropriate for you to counsel someone on child protection and drug rehabilitation. Discussing the situation with others is an obvious breach of confidentiality, which therefore makes options E and G inappropriate. While informing their GP of the situation, F is, of course, important. There are other people in the team who could do this, and you are much safer staying completely out of the case. The situation could be potentially dangerous for the child, but you should not immediately try to remove the child from the father's care, as this is potentially damaging for the entire family. And a social worker would be a much better person to liaise with the family around this. This is also the case for option H, so you should instead give the consultant all this information, A, and then be removed from the situation. You're doing a taster day in a GP surgery. The GP you are shadowing is doing some telephone consultations. She brings up one of the patients on the screen, and you note that they have a history of depression. You subsequently realize that she is talking to someone that you know from your local running club. He has never mentioned anything about this to you. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. In future, check the name of the patient before each consultation to avoid similar situations. B. Leave the room during the consultation so that you do not hear any more of the conversation. C. Look through the rest of his medical records later so that you can get an idea of the severity of his depression. D. Next time you see your friend, ask him if everything is okay and let him know you are available if he wants to talk. E. Speak to the GP following this and discuss the best way to proceed. Answer: A, E, B, D, C. In this scenario, the only correct way to act is not to allow your friend to know you have found out medical information about him and to try and treat him in exactly the same way as before. This is a difficult situation, especially when it concerns a mental health diagnosis. Unless your friend seeks your help regarding this problem, you cannot approach the subject with him. The best option from here on is to check all patients' names before you see their records, which would prevent you from finding out personal medical details about them. It would also be wise to discuss this with the GP, as they may have some helpful advice for you, and it would also make them aware that you may know other registered patients. Getting up and immediately leaving the room, B, while appearing strange initially, could easily be explained to the GP after the telephone consultation, and the GP is likely to be very understanding. Offering support to your friend, D, would be a caring thing to do, but it is not appropriate since this would alert him that you have discovered confidential information about him. Reading through his notes, C, is an obvious breach of confidentiality and is the worst option in this scenario.